Hey guys, thanks for joining tonight. We are going to go ahead and get started here. I think we have a quorum. So tonight we're going to be doing our Menopause 101 workshop. Thank you for joining us. We're talking about the 5 actions you need to start taking today to plan for a smoother menopause transition. So we're going to start with a little quiz. And I don't have the recording capturing the Q&A answer box. So if you're following along from home after the talk and the recording, just go ahead and hold the answer in your mind before we move on. So here's our quiz to test your menopause knowledge. And don't worry about how much you get right, and hopefully I'll answer all of these during the talk tonight. So question 1, what age does menopause typically begin? A, 40, B, 45, C, 50, or D, 55? And I'll give you a few seconds to come up with an answer. Okay, we'll move on. Question number 2. A woman is considered to be in menopause after she has missed how many menstrual cycles? A, 3, B, 6, C, 9, or D, 12? All right, I think people knew this one. I see a lot of votes for 12. So we'll talk about that. Good. All right, question number 3. How many women experience hot flashes during the premenopausal stage? A, 100, B, 75, C, 50, or D, 30? C, 75, a 50, 75. So most votes go for the 75. All right. Question 4. What is the most serious disease risk after menopause? You have A, hot flashes, B, osteoporosis, C, heart disease, or D, which is B and C. See how many use our test taking skills here. Yeah, a few votes for D, osteoporosis and heart disease. Yeah, all right. And last but not least, question number 5. Hormone replacement therapy minimizes some of the symptoms of menopause. Which hormones are used? We have A, estrogen, B, estrogen and progesterone, C, testosterone, D, thyroid hormone. All right, I'm seeing votes for estrogen, progesterone, testosterone. All right, we will definitely cover that as well. At first, I just wanted to start off with a patient example. So this is a story about my patient Miranda, and I did change her name and some of the details just to keep it anonymous. But when I first met her, she was in her late 40s, and she had come to me and told me that she had been having about 3 years of kind of vague symptoms, just feeling like trouble concentrating at work. Noticed she felt more tired. She was starting to gain weight, even though she hadn't changed anything about her diet or her physical activity. She was still getting menstrual cycles, so she was still having a regular period. Um, and she was also starting to have hot flashes, not what people would consider like super bad hot flashes, but they were interrupting her sleep some nights. She wasn't sleeping very well, and they would come on randomly occasionally through the day, and she just felt like she wasn't doing as well at work because of this. And, this had been going on for 3 years by the time I met her. And I felt bad that she had spent 3 years going through all this constellation of symptoms when it felt like pretty clear to me that she was starting to have symptoms related to perimenopause. Even though she was having regular cycles, she was the right age, kind of had all the constellations. we did a workup just to make sure we weren't missing something else. And then we were able to get her started on some therapies and just kind of talk through treatment. And she felt so much better. So my message to you is really do not let this happen to you. Do not suffer with hot flashes and symptoms for 3 years before you finally decide to seek help. I want to empower you to have the knowledge so that you can get help and work with a provider who is knowledgeable before, um, going many years, months and years without treatment. Right, so tonight, in our little mini workshop, we're going to just talk about understanding what is menopause and how that's diagnosed. What are some of the most common symptoms and some management tips for those? And then we'll talk about these 5 key actions that you can start taking today, whether you're in your late 30s, your 40s, your early 50s, to start planning for a smoother menopause transition. And then we'll wrap up with some Q&A. For those of you who don't know me, I guess I should start with an introduction. Hello, hi, I'm Dr. Stephanie Deeds. I'm a board certified physician practicing internal medicine and obesity medicine. And I am a strong women's health advocate and have a strong background in both practicing primary care as well as women's health. And I'm the founder of Deeds Health, which is a holistic membership-based medicine clinic in Seattle. I have had my previous career working as a faculty at the University of Washington and working at the VA, as I mentioned, in primary care women's clinic, and was a medical director overseeing 2 large women's health clinics in my time. I'm really passionate about helping people just understand what's going on with their health, kind of uncovering conditions and regaining health that has been lost. I'm a mom of 2 very energetic boys that keep me busy, age 3 and 5, and living in West Seattle. And here's some of my pictures of my family. When I'm not working, you kind of find me walking, run around town, exploring the neighborhood, eating good food, and occasionally coaching my son's baseball team. And I will tell you now that I struggle to fit it all in just as much as the rest of you all do out there, balancing full-time work, full-time parenthood, and all the things. But really loving every moment. Part of my goal with doing this workshop tonight is to really educate our community. And I want our community to be strong and healthy and come together. And that is part of my mission for my clinic, is to give back. So in working with women, I just found that many were caught off guard, like that story about my patient Miranda. They weren't really prepared for menopause. They didn't necessarily recognize that maybe the weight gain, fatigue, brain fog, urinary symptoms, sexual changes were related to both these hormonal and lifestyle factors that happen as women go through menopausal transition. So let's talk about, well, what is menopause? So menopause is a completely normal part of a woman's life, marking the end of your reproductive years. The baby makers have shut down. It is a single point in time when women have their last menstrual period. It's defined as the 12-month mark without a menstrual cycle. So if you've hit 12 months with no period, you have gone through menopause, or that is your age of menopause. Again, it's absence of a period for 12 months. It is not diagnosed by a specific lab test. We do not use a lab test to diagnose it. In a woman who is of the appropriate age to go through menopause and has not had a period for 12 months, that is our diagnosis. And you'll see why in a minute, why we don't use lab tests and just why they can be inaccurate. Again, if you're in the classic expected age range to go through menopause. So what's going on before we enter menopause? So this is in pre-menopause. This is a figure just showing us our cycle, our menstrual cycle, and our hormone levels that fluctuate every month. So this is a graphic that I drew for a typical 28-day or monthly cycle, which, most women are plus or minus 28 to maybe 35 days for their regular cycle. So day 0 is the start of your cycle. That's when you're bleeding, the menstruation part. And our hormone levels, you can see, kind of even keeled low during that time. Then what happens is we start to get an elevation in estrogen levels. And as the estrogen goes up, we're developing an egg inside of the ovary. It's getting prepared to release this egg. And so again, our estrogen levels kind of go up. Then there's this signal that comes down from your brain, a surge of a hormone called LH around day 14 plus or minus. And that is the day you ovulate, which means you release the egg. Shortly after that, we get another surge of another hormone called progesterone. And the progesterone, its job is to prepare your uterus, the endometrial lining, to receive that egg. So that egg has to go find some sperm and then get implanted into that endometrial lining that has gotten prepared, and then you can become pregnant to make a baby, right? And when that progesterone kind of goes up, or estrogen levels kind of stay a little bit elevated there, the lining gets thickened, and then when an egg does not implant, it doesn't find any sperm, it doesn't implant in the uterine wall, we go back here and we shed all of that lining that has built up. And we do this every month for many, many years and decades from when we start having our period until we get to perimenopause. All right, so what's happening in perimenopause? So as we age, that communication and hormone signaling between our ovaries and our brain, it kind of goes out of cycle, and we aren't making, we're not releasing as many eggs. Our eggs are kind of getting older. The hormone signals are not as strong. And we go from this regular monthly pattern to like a very messy, irregular pattern. So I kind of squished all those cycles together here. We've got like regular cycles, and then we've got all sorts of erratic cycles happening. So this is why when you enter perimenopause, some women will have shorter intervals or cycles, some will have longer, some will kind of have some regular times, maybe spread out with some irregular times. And that's also why checking a hormone level at this time is not always very accurate, because at any given time or day that we check the hormone levels, it may not give us that useful of information. And so we use other things like symptoms to help us and age to put the picture together. And then finally, when we get into postmenopause, we see this pretty big shift where the central acting hormones are higher, the FSH and LH, and our estrogen and progesterone levels kind of settle out at a lower consistent level than we were having in premenopause and perimenopause. So we end up overall with a lower estrogen and progesterone through our bodies during this postmenopause phase. So during perimenopause, we're having that irregular hormonal regulation pattern. Again, it can be an irregular amount of time, and this is when symptoms tend to start to crop up and be common. Not everyone has symptoms, but if you're going to have symptoms, this tends to be when they occur. And that typical age range for when this happens, when perimenopause happens, is between age 45 and 55. So there's a 10-year time span for this. Typical age to begin. And it can start sooner. So the median age of menopause for women in the United States is age 51. But those symptoms of perimenopause, where our hormones are kind of fluctuating, can begin 10 years sooner. So if you see, a woman could go through menopause as early as age 45, and that could still be considered normal. If she were having symptoms of perimenopause, those could begin as early as her late 30s, because it's 10 years before she finished going through menopause or completes menopause. Where on the other end of the spectrum, a woman who goes through menopause, let's say age 55, which kind of on the older end, she might starts to have symptoms in her late 40s. Mood swings, night sweats, and migraines. I felt like I was spiraling out of control, like this quote from Naomi Watts. So even celebrities have to go through menopause, just like the rest of us. Half of the population goes through this process. And so we really want to empower you to know more about it and know what's coming. So let's talk about some of those symptoms. As we really understand what's going on in the body, what are some of the common things that are going to be happening, and what you can anticipate so that you can be more prepared for managing these as they start to come up. All right, so let's start with the first one. Let's start first with going over what are some of the most common ones. So hot flashes. Around 75% of women experience hot flashes or vasomotor symptoms of menopause. So if you got that right during our multiple choice quiz, that is the most common symptom of menopause. Another very common symptom is vaginal dryness. So almost 50% of women experience vaginal dryness and genital urinary symptoms in menopause. Sleep troubles are also really common, either trouble falling or staying asleep, with almost half of women reporting this worse sleep during menopause. And mood problems can also crop up during this time. About 1 in 3 women in perimenopause do report either depression or anxiety or troubles with mood. Other common symptoms include things like dry skin, itchy skin, hair loss, mood swings, irritability, irregular cycles, urinary infections, pelvic pain, and weight gain. So there are a whole constellation of things that can be related to these hormonal swings during menopause. Let's start with talking about hot flashes or those vasomotor symptoms. Again, this is kind of a signature symptom that everyone kind of expects or thinks of when they think of menopause. And it's really caused by the drop in estrogen levels. So our central thermostat in our body, our hypothalamus, becomes more sensitive to little fluctuations in temperature in our body. When we're get a little bit too warm, it sets off a whole cascade of responses to try to cool the body down. And that can result in this hot flash. And for some women, they continue even beyond menopause and may continue for another 7, 10 years. I've seen women even later in life who still feel like they're experiencing some of those hot flash symptoms that started when they went through menopause. So what can we do to help these vasomotor symptoms? Well, certainly keeping the temperature down, making sure it's nice and cool when you sleep, dressing in layers so that you're always prepared, having some cold water, especially some ice water, maybe at the bedside, although don't drink too much. You might be up all night peeing. Making sure you're using cotton clothing, cotton sheets, not smoking and avoiding things that might be triggering. So that includes, for many women, spicy food, red wine, and caffeine. Sorry, yes, if you're having pretty severe symptoms, these are things you may need to cut out or reduce. Yoga has been found to be helpful among other exercises. And just in general, managing stress, anxiety, and practicing relaxation techniques can also help. Now, what about hormone replacement therapy? So hormone replacement therapy for most women includes estrogen and progesterone, and it is a very safe and effective option for treatment for these vasomotor or hot flash symptoms. There are some other non-hormonal prescriptions for women who maybe have a contraindication to taking hormones that might be an option, and some supplements that have some evidence as well. And so I would advise a woman to really talk to a doctor if she's having symptoms that include hot flashes, because this can be a game changer and really control things well. And it is our mainstay kind of gold standard for treatment. All right, another common symptoms include those that are related to sexual health. So things that may happen or you may experience include changes in libido. So a lot of women notice a drop in their desire for sexual activities, although some feel more freedom knowing they can't get pregnant anymore and maybe they have an increase in desire. A lot of women also experience vaginal dryness or pain that just makes sex uncomfortable, and so they don't want to have sex as much. And then another symptom that can come along with that vaginal irritation includes some frequent urinary infections or even incontinence. What helps with this? Well, first of all, lubricants, lubricants, lubricants. So KY jelly is your friend. You could use this on a daily basis just to keep the skin and area moist, and as needed before intercourse. More frequent intercourse can also increase blood flow to the vaginal tissue, and that can improve some of the pain. Pelvic floor physical therapists are your best friend. I know I've got a pelvic floor therapist on this call. Thank you for joining us tonight. She's wonderful. If you're interested, let me know. I can connect you guys. But pelvic floor physical therapy can be helpful for the pain, any incontinence that you're experiencing. And then vaginal topical estrogens are extremely helpful for these sexual symptoms. And they can help kind of restore the health of the tissue to decrease pain and reduce infections. All right, let's talk about sleep trouble. So again, women may report trouble falling asleep, staying asleep. If they're also experiencing anxiety, that can be playing into this. If they're experiencing night sweats, that can be playing into this. So, and then that lack of sleep can in turn impact their anxiety, their depression, their mood, the quality of their life, and their weight, ability to think clearly. So the sleep is critical, and it is something that we really need to work on protecting. So what are things that help? Well, our basic sleep hygiene here: being active, being out during daylight, getting sunlight exposure, using your bedroom for sleep only, not eating or drinking too late into the evening, not drinking alcohol in the evening or late at night, reducing our screen time, our scroll time, doing a relaxing bedtime routine, and sticking to a schedule, going to bed, getting up around the same time every single day. What about mood changes? So a lot of women will have mood swings or irritability on top of some anxiety and depression. This can be related to this topic of sleep and stress like we talked about, but also there's just a lot of social changes. Maybe kids are going off to, or in high school or going to college. Parents are aging, getting older, needing more help and more care, and just general changes to your body. All of this can and may impact your mood. So things that help: talking to your doctor about it and being open, maybe getting connected to a mental health professional or a therapist. If you don't have access to that, or you feel like there's something more minor, just having a circle of friends, girlfriends to chat with, family, somebody you can trust, someone to decompress with. Working on managing your stress with breathing techniques and meditation can be really important. Again, continuing to do some exercise and getting out and doing things you enjoy, even when you find them to be difficult. Getting a handle on our sleep and practicing gratitude has also been shown to be helpful for mood. All right, and then the elephant in the room: people always are worried about the weight gain they see with menopause. I can't tell you how many women come to me in their perimenopause just feeling like things are different. Their body has changed. And they're right, it has. If you meet a woman where their body didn't change through perimenopause and menopause, they likely were doing something very proactively to try to combat that. So shifts in our body with the drop in estrogen mean that we have a reduction in our muscle mass, or we lose some muscle mass, and it makes it easier to put on, or an increase in our fatty mass tissue. And so not only does losing muscle make it easier to gain weight, because muscle burns more than fat, and so when we lose muscle, it burns more calories. So if we have less of our calorie burn, it makes it easier to put on weight. Many women also just naturally maybe moving less. Kids are older, maybe they're not like running around as much, sedentary jobs, that trouble with stress and sleep we talked about. All these things can play a role in your metabolic health and make it easier to gain weight at this time. In general, I see that people gain 1 to 3 pounds per year throughout their life in their kind of older years in the aging process, unless working to prevent it. And then the metabolic changes that come along with increasing weight and increasing fat mass compared to muscle mass makes women more at risk for conditions like heart disease and diabetes, because they tend to put on that weight in the abdomen or visceral fat, which means fat that's around the organs. And that really does increase a risk for some of these chronic conditions. So heart disease is one of the biggest risk factors for postmenopausal women. So what helps? Things that you know, tried and true things to do: staying physically active, eating more veggies, eating less ultra-processed to processed food, having a strong support system, and really focusing on that sleep. But if you've been at it for more than 6 months, you feel like you've gained a lot of weight, you're not and you've tried all these things and they're really not working for you, I would talk to a doctor. Really want to rule out any underlying conditions that might be making it harder to gain weight, or sorry, harder to lose weight, or might be causing some weight gain and contributing, and to see if you might benefit from any pharmacological or medication management in addition to the lifestyle things that you've been working on. I would love this quote from Michelle Obama about some of her menopausal symptoms, perimenopause symptoms. I'm dressed, I need to get out, walk into an event, and literally it was like somebody put a furnace in my core and turned it on high. And then everything started melting. And I thought, well, this is crazy. And I just think that's such a great description for what a hot flash feels like. And I thought, man, if even the first lady can't get someone to treat her for her hot flashes, what's the hope for the rest of us? I hope she saw somebody after this. But yeah, a great description from Michelle Obama. Right now, we're going to shift gears and we're going to talk about the 5 key action steps that you are going to start taking now if you want to get a handle on things and be prepared for your perimenopause to menopause transition. So we're going to start with action number 1. Eat more fiber, at least 30 grams a day. Yes, this means you're going to eat a lot of vegetables and fruits, because when we eat more vegetables and fruits, we're going to feel more full. We're going to have less room to eat that unhealthy processed junk or snacking. We're not going to waste any calories on processed junk food. But we're also not going to ignore our hunger. If we're hungry, we're going to eat, but we're going to go for some of those things that are going to be more powerful for our system, which includes vegetables, fruit, legumes, those fibrous foods. So when you're hungry, eat, but reach for something balanced, reach for something filling, and try to hit this target for fiber. Okay, now action number 2. You are going to increase your protein intake. This is the other thing you need to eat more of, right? And I set a target for my patients of 0.6 to 1 grams per pound of lean body mass. So what is lean body mass? So for most people, it's about 75% of your current weight. For some people who have gained a lot of extra weight, I may say, think about what your target weight was, kind of like when you felt your best, or what your goal weight was. That might be what you're going to use for a protein target. So let's say if you weigh 160 pounds, and your lean body mass then would be about 120 pounds. If we kind of target this range of 0.6 to 1 grams per pound, we end up at about 96 grams per day. So if I lost you on the math, we'll bring it back now. For most women, a target is going to be somewhere between 70 and 100 grams of protein per day. And then we're going to break this up into our meals and snacks evenly throughout the day. So you're going to try to target about 20 to 40 grams of protein per meal or snack. Now, I send all of my patients to get a body mass analysis scan or a DEXA scan to look at their fat mass so that we can kind of get more nitty gritty about this. But if you follow these general rules, you'll be well on your way to hitting your target. And this protein is so essential for helping with maintaining our strength and our muscle mass, which we already talked about how we tend to lose as we get into postmenopause and perimenopause because the estrogen has dropped. And so we need to take more protein on board in order to restore and regain our muscle mass. All right, action number 3. You are going to take vitamin D and possibly calcium. You do not need any other supplements. Someone is going to try to sell you something or lots of things, but you really probably don't need them, right? You need vitamin D. 1,000 international units a day is plenty for most women, maybe 1,000 to 2,000 if you've been low in the past. And that should be enough. You don't need the super high, crazy doses. You also need 1,200 milligrams of elemental calcium. So you can get this from leafy greens, or dairy is a good source if you tolerate dairy. But sometimes you may need a supplement for calcium. And I find it kind of annoying the combo pills for vitamin D and calcium seem to never have the right target doses. I don't know why that is. They want you to combine a few together, but you can buy supplements that are combined, or you can take them separate. Now, magnesium is another supplement that may be helpful, but I tend to recommend a food first approach. But there is some evidence that making sure that you're having enough magnesium can be helpful for both like sleep, mood. Of course, it helps with regulating digestion and going to the bathroom. So some people choose to either take magnesium or just use that also as a target in their diet. All right, action number 4. You are going to get stronger through resistance training or strength training of some sort. No, we are not going to get toned or lean or thin. We are going to get strong. And this involves having a strategy around how am I going to get strong. I already told you that you are going to lose muscle mass when your estrogen levels drop. But we don't have to lose muscle mass. Maybe this is the time you are going to gain muscle, okay? But you have to start somewhere and you have to work for it and plan for it. So to start, you can do anything. So including body weight exercises or yoga. You need to start somewhere to build to get stronger. And then I really encourage people to move from body weight into actual weight lifting of some sort with resistance, working on progressively increasing the load or increasing the reps. And do not fear if you do not like strength training, there are tons of options. If you're really new to it and you're just getting started and don't know what to do, you can find a personal trainer just to work with for a little while until you get comfortable. There's plenty of classes, group classes you can join with in your neighborhood. Home videos, there's YouTube, there's Peloton, there's a ton of strength things online these days. If you can pick up some weights or resistance bands, you can find something. Yoga classes, all the way to something a little more intense like CrossFit. But I always give a caveat with CrossFit to be careful. I've met tons of patients who end up getting injured from doing CrossFit, but there is there's a right way to do it. And then I think there's some injury prone there. But if my main message is to do something and try to get at least 2 strength training episodes in per week. Okay, action number 5, our final action item for you. You are going to protect your sleep. We already talked about sleep so much tonight. How it impacts everything else is a common thread all the way from mood changes to weight to brain fog. You want to get 7 to 9 hours of sleep. I think the sweet spot really is in that 7 to 8 hours. There is a U-shaped curve between health and disease risk and between weight gain and sleep, meaning that if you get less than 7 or more than 9, you have increased risk of diseases, cardiovascular disease, chronic diseases. So the evidence shows that there is this kind of narrow range that is ideal for sleep. So poor sleep begets more stress and poor mental health. So if you are sacrificing your sleep for your family, for your job, you just need to stop doing that, because if you don't take care of yourself, you're not going to be available to take care of everybody else. And I know that that's what you've been doing. So now is the time to think about this and really prioritize it and make a plan. Okay, and then I have my bonus secret for you. And I'm going to start with this quote from Oprah. I've discovered that this is your moment to reinvent yourself after years of focusing on the needs of everyone else. My bonus secret message for you is that now is the time to feel empowered. Be who you want to be, and think about that. You're going to step into yourself. Many women have found this transition to be a time to explore who they want to be. And I really believe that you can have a graceful menopause transition. So your body might not look the same. You might not feel the same. You may never be the old you, but you can step into yourself and just re-emerge from it. It's a time of reinvention. Do the things that you want to do that matter to you, because you don't have time to do the things that don't anymore. And I'll leave you with this Brene Brown quote. I think midlife is when the universe gently places her hand upon your shoulders, pulls you close, and whispers in your ear, I'm not screwing around. It's time. All of this pretending and performing, these coping mechanisms that you've developed to protect yourself from feeling inadequate and getting hurt has to go. Right? This is the time for you. And just remember that. All right, so what did we cover today? We covered that menopause is a natural life event and it comes with some real symptoms and health challenges, but you are going to be prepared for those. The symptoms of menopause and perimenopause can be prevented and they can be treated. By taking these 5 key action steps that we covered today, you can start your progress towards a healthier perimenopause and menopause transition. All right, and before we get to the Q&A, I just wanted to tell you a bit more about us for those who are curious. So the Deeds Health Clinic is a membership-based medical clinic in West Seattle, in Seattle, Washington. And what does a membership-based clinic means? It means that we provide direct care to patients for a flat monthly fee, like a subscription fee to our clinic. We don't bill insurance. We don't accept copays. We don't work with them. Quite frankly, I prefer not to have to deal with them ever again if I could, but I do. I'm an out-of-network provider with insurance companies, and I do use their insurance for labs, medications, referrals, things like that. But everything that you need is all under one roof with me. You get unlimited access to visits, phone calls, text messaging, into our patient portal, email, same day, next day access. You get to know who you're working with. When you reach out, you get a response from your doctor. It's really that concierge experience of medical care where there's on-demand access for you, but also really with a focus on that relationship and providing holistic wraparound care for you so that you can have a long-term relationship where we get to know each other and we can really tackle issues head on and with an eye to doing things that involve lifestyle and medication and combining those things together to have the best outcome possible. The things that we offer include that flagship primary care membership that I mentioned. Again, that's our signature program. And I run a 6-month weight loss program, a weight loss membership for people who have been seeking or interested in learning about medication-assisted weight loss, where we combine holistic lifestyle and medication management for weight. And I also do longevity consults for people who really want to know how to optimize their health, to prevent diseases of aging, prevent diseases as they get older, and really optimize for now and the future. And we do those as well. If you're interested at all, please reach out to me. You all have my email. It just starts with a discovery call. Talk about our services. No pressure. Just get to learn more about you. You can learn more about us and see if it might be a good fit for you. All right. And with that out of the way, let's move on to our Q&A. So I am just going to read these off from the chat tonight. Okay. So our first question comes from Zita. So regarding hormone replacement therapy and breast cancer, has heard about the risks and just kind of wanting to know my thoughts. So there was a large study called the Women's Health Initiative. And this was conducted in women in their 60s to see if hormone replacement therapy, estrogen and progesterone, given to women these women were postmenopausal in their 60s to see if it reduced rates of cardiovascular disease or reduced cardiovascular event risk. It was stopped early because there was this kind of indication of a higher rates of breast cancer. And again, so the population of patients here, they were not having hot flashes, they were not having symptoms, they were not perimenopausal. They have gone back and looked at this data and looked at real world data and said, you know what, we were wrong to put this out. And they actually did this quite early, but doctors had already pulled everybody off their estrogen and stopped prescribing hormone replacement therapy because of, oh my gosh, we're causing increased rates of breast cancer. The absolute rate of increase was not that great. And but so you have to make an individualized assessment about using it in age, ages beyond 60, kind of getting that age. But all the evidence we have is that women who are having hot flashes, who are perimenopausal in that like 45 to 55 range, that hormone replacement therapy is actually quite safe. We can use it for 10 years, seems like up to 10 years, very safe in this time frame. And it may actually help with that cardiovascular disease risk. So some of those things are ongoing. No one's ever going to repeat this study because of the outcomes it had. I don't think there's interest in doing that, but I can say with confidence that it can be safe and effective for most women who are in perimenopause and having symptoms. So yes, and the rate of breast cancer risk in this population is, again, not the same as what this other study showed, where it had to be stopped early because it was being done in older women who were not having any symptoms. I think there was, okay, so the next question was about hormone replacement therapy. How does it work? So hormone replacement therapy is essentially replacing that lost estrogen. And when you're having kind of those like fluctuating estrogen levels, taking supplemental estrogen or an estrogen patch gives your body that even ride, an even keeled dose of estrogen. It's a low dose, but it's supplementing from that drop. So you don't have like these fluctuations in that drop. You're going to get this like even steady level of estrogen, and that can help ease and support the symptoms because a lot of those symptoms are coming from the swings and the drops and the low level of estrogen. And so it kind of helps even it out, and then we can continue that on. And then when women think, kind of postmenopausal, let's peel it back, see if we stop having symptoms. And there's no real right timing to stop. So someone asked about when to stop. But if you've been on it for many years, yeah, like I said, we'll just kind of trial off and see how you do after we think we're kind of out of the window of the perimenopause time. So someone next question, he's asking, can birth control act like hormone replacement therapy in perimenopause? It's not, so birth control does have estrogen in it. It is not the same as hormone replacement therapy. It's not the same dose, but in my personal experience, I have seen that some women who are on birth control or have like an IUD don't have as many like hormone fluctuating symptoms. I do think maybe there's some evidence or a little bit of anecdotal evidence there that birth control might ease symptoms a bit. And certainly that women with IUDs, sometimes they're not having any cycles. So they don't even know if they've gone through menopause. They didn't have any symptoms. And then they're like, well, I'm age 50, maybe I did. And we take out their IUD and their period never comes back. So they went through menopause and had no problems, no symptoms. And we just removed their IUD and found out that they were postmenopause. And that's perfectly okay too. You don't have to be on the replacement therapy. I guess the other point of the question, we would, for some women who are on birth control, if you were having hot flashes, I would take you off of birth control and switch you to an estrogen patch because we're treating something different in that case. Okay, next question. You were asked, you don't know if you're going through perimenopause, but you're getting direct to consumer advertising for human growth hormone. And I didn't mention that. So is that something, my opinion about using human growth hormone? So yeah, human growth hormone is not a treatment for menopause. No, that's not FDA approved. It's not recommended. It's not a treatment. So I am not sure who is using that, but I'm sure you're going to get a lot of targeted advertising for lots of things, and I would just say no to that one. Okay, next question is, or comment, you have mood swings in general, like premenstrual mood swings, don't think you're in perimenopause yet, you're almost 40, and I mentioned magnesium, so you're kind of wondering what type of magnesium you've seen. There's lots of types. So yes, there are lots of type of magnesiums. I can send you a link about that afterwards. Magnesium oxide is a fine place to start, although that one primarily works. It can have a lot of bowel side effects. It can't clean you out. There's magnesium citrate, magnesium chloride. There's a new one, magnesium L-threonate, that supposedly crosses the blood-brain barrier better from what I've read about it, and maybe can help more with the sleep and mood. But they all do have elemental magnesium in it, so it's just about getting that right dose that can work and one that you can tolerate for your gut. And just a couple other comments about thank yous. And yeah, I'm not seeing any more comments or questions. All right, if you have anything that you think of after this talk that you want to know, please feel free to reach out to me. I would be happy to answer them either by email, or you can find me over in Instagram. I put my name here. It's at SephiTeadsMD. I'm pretty active on there. You can message me on the DMs or follow me. And I try to post somewhat frequently information about menopause, general health, longevity, staying healthy, managing weight, using lifestyle and medication. So with that, I just want to say thank you to everyone for being here, and it's been my pleasure to talk with you all tonight, and I hope you have a lovely evening. And if there's any topic requests, let me know, and I'll think about planning another little workshop or mini talk. Bye, everyone.